Everyone, and thank you again for joining us for this webinar as part of our mental health series. This webinar is called Recharging Batteries. My name is Brenda DeLauder, and I am the Executive Director with the Canadian Spondyloarthritis Association, and I am just thrilled to be here today with our expert presenter. And as we begin, please feel free to use the chat and tell us where you're coming from in the country. We would also like to ask that you use there's a Q&A question and answer feature in this Zoom webinar. You can find the feature in the console to ask some questions. This allows us to track the questions asked, and if we aren't able to get to them, we will be sure to answer them following this event. So once again, the Q&A feature can be found at the bottom of your Zoom window. And if you don't see the option, you might just need to look for the three dots before you can access it. And once again, please be sure to use that chat feature to tell us where you are joining us from. And I would like to begin by acknowledging the Indigenous peoples of all of the lands that we are on today. Today, yes, while we meet on a virtual platform, it's important for us to take a moment to acknowledge the importance of the land, which we each call home. I am coming to you from the region of Hamilton in Ontario, and this is a part of the treaty lands and territory of the Mississaugas of the Credit. We do recognize that those joining us are doing so from across various lands and territories. And for thousands of years, Indigenous peoples inhabited and cared for these lands and continue to do so today. We are grateful to have the opportunity to work and live on this land, and by doing so, give our respect to its first inhabitants. So this is a slide that some of us have seen before, and it's a snapshot of really what spondyloarthritis is. And it describes, a group of chronic inflammatory arthritic diseases with common features including inflammation of the eyes, the skin, the spine, the gastrointestinal tract, and others. We know that these conditions are painful, they are debilitating, and particularly for those individuals that are experiencing disease progressions. People living with SPA are greatly impacted physically and emotionally and mentally. And we acknowledge that it does take a toll on them, as well as their loved ones, as well as their caregivers. And most individuals begin experiencing patients between the ages of 17 and 45. And we refer to this as a young person's disease. And it hits people in the prime of their lives. So here at the Canadian Spondyloarthritis Association, the CSA, we really focus on three main areas. The first is reducing that time to diagnosis. The second is awareness and patient education. And the third is advocacy with the goal to influence policy. Today, as one of those objectives, we are bringing to you this educational segment on recharging batteries. Just before we begin, I want to take a quick moment to extend our thanks and our gratitude to some of our partners. With their support, we're able to provide you with these types of opportunities to help better inform and support our community. We also wish to disclose with full transparency the funders of our webinar series, as well as acknowledge these partners who make this and many other programs, services, and resources offered by the CSA possible. So please accept our thanks. And it is now my distinct pleasure to introduce our expert guest presenter. And as I do so, thanks to those who have submitted questions in advance. For those who wish to ask questions during this session today, please use the Zoom Q&A feature. And we will focus on moving through the questions that were submitted in advance, and we'll try to get to all the questions. If we don't, we likely won't. We will reach out to you after. And also, if you would like to turn on captioning, this is available in your Zoom menu as well. And of course, please continue sharing where you're coming from if you haven't done so already. So I know I've had the pleasure to introduce Dr. Dana Lee Bagley before. So for some of you, this is a reinforcement of the expertise and the knowledge that she graciously brings to the members of the CSA. So, Dr. Lee Bagley is a registered clinical and organizational psychologist in Nova Scotia, BC, Ontario, and Alberta, with reciprocal agreements for clients in Atlantic Canada and Quebec. She has extensive applied experience and research knowledge on behavior change, team functioning, conflict resolution, workplace restoration, diversity, equity, inclusion, trauma informed workplaces, restorative justice, and organizational change. She is on the faculty at Dalhousie University in family medicine and at St. Mary's University in industrial and organizational psychology. She tries to make training meaningful and safe using evidence based methods and processes. She was the recipient of the 2017 Women of Excellence Award for her contributions to health, sport, and wellness. And she is the author, for many of you who know, have read her book, she is author of the book Healthy Habits Suck: How to Get Off the Couch and Live a Healthy Life, even if you don't want to. If you haven't read it, we encourage you to do so. Welcome, Dr. Lee Bagley. It is so great to have you here with us today.
Thank you for having me.
Yes, thank you so much. So I am now going to let you take the screen to share your presentation.
Perfect. So I will share my slides. Awesome. So we're going to talk about charging your battery, or how to recharge your battery. So I've been introduced already. In my previous work, I worked for almost 15 years on the medical, surgical, and cancer care units at the hospital here in Halifax, where I live. So working with people with chronic disease and life-threatening disease. Lots of experience in dealing with people with chronic conditions. I was there until wave 2 of the pandemic, and then I left, and now we also do work on healthy workplaces, in addition to empowering individuals who want to create environments that are healthier for people as well. So first of all, let's just acknowledge, why are we so tired? We hear this a lot, right? And basically, we can recognize burnout is one of the ways we can make sense of this. And burnout is the long-term outcome of chronic stress. It's about feelings of energy depletion or exhaustion, mental distancing or cynicism, and reduced professional efficacy. Sorry about the slides. They are showing up differently than how I created them on this platform, but hopefully you can still see that. And so basically, it's a sense of like emotional exhaustion. Sometimes people are like, all I did was like sit at my desk today, but I feel exhausted. Mental distancing or cynicism is sort of this sense of like, why bother? And then it's just harder to get things done. And so another way of understanding this is cognitive fatigue. And in a recent study, cognitive fatigue was one of the top barriers to adopting a healthier lifestyle. 63% reported mental or cognitive fatigue, which is again, that sort of emotional, mental sense of fatigue, and that it was a barrier to engaging in healthy behaviors. Previous years, this didn't even make like the top 5, and now it's one of like the major contributors. And so this is helpful for us to recognize that this is really it's a new and significant problem for lots of us. So it's not just you if you're feeling extra tired. So we can understand this a bit in terms of how brains work. So our survival mind is responsible for things like emotions, automatic thoughts, pain regulation, appetite regulation, and it's built for survival. So it gives you awesome advice if you're a cave person and your life expectancy is 30 and kinds of threats you deal with are bear attacks. It also functions automatically and unconsciously, so you can't turn it on and you can't turn it off. The other relevant part of our brain is our prefrontal cortex, or our frontal lobe for short. This is where executive functioning happens, and that's things like decision making, planning, starting behavior, stopping behavior, concentration, attention, and probably a bunch of other things I can't remember right now. It basically can control our behavior. It's the location of willpower or self control. But unlike our survival mind that's always working, our frontal lobe is more like a battery, and we will wear out that battery of self control. And so, both because of the pandemic and this new normal post pandemic, basically our survival brains are on fire and our frontal lobe batteries are spent. There's a lot of stress in the pandemic. It impacted all of us in different ways, but it was stressful and required a lot of change for everyone. And this new normal after the pandemic is also a lot of uncertainty. And it's a lot more uncertainty than we had to deal with pre pandemic. And survival brains hate uncertainty. It's a threat to survival if you don't know what's coming, if it's uncertain. And so that causes a lot of stress. And we have to use our batteries for things we didn't need to use them before. Even simple things like medication shortages or supply chain problems, inflation, mortgage rates, all these things lead to stress. They're all attached with uncertainty, and it means that they're draining our batteries more than before. And so there's kind of like no frontal lobes anymore. Everyone's really tired. And so this is, we see this pretty consistently across all kinds of surveys that are done. When you have a chronic health condition, the pain attached to a chronic health condition is coming from your survival mind. It is also like having a survival mind on fire. Our survival minds don't understand chronic pain. They think that you're under threat. They will encourage, to not move because that is a way to manage pain when it's an acute illness or injury. But it ends up being not a good strategy when you have chronic pain or ongoing pain. And so that pain is coming from your survival brain, which means that there is even more kind of activation in that system. So that is also then using up frontal lobe battery. And so what that means is when you have a health condition, part of your battery is used up by your chronic condition, and you have even less battery to play around with. So the first thing we want to think about is recharging activities. And a recharging activity is something that makes you feel more energetic at the end than when you started. So common ones include things like sleep, eating healthy food, staying hydrated, physical activity, being in nature, and social connection. But there's also individual differences. So for an extrovert, being with other people is going to be recharging. For an introvert, that might be draining. There's also an optimal amount of time. Going for a walk for 20 minutes might be recharging, going for 6 hours might be draining. It's not necessarily the same thing as a healthy habit. So if going for a walk makes you feel angry and irritated, then it's not a recharging activity, even if it's a healthy habit. We're looking for things that make you smile, things that make you feel a bit lighter, things that bring you a little opportunity for joy. And so they might be things like ones that I've heard are like drumming or gardening or organizing a drawer, right? Cuddling with your dog. And so we're aiming for things that don't feel like yet another should on my list of things to do. We're looking for things that actually make you feel a bit lighter when you finish them. One of the main things that we need to think about when people have a chronic disease is pacing. And this is about recognizing that battery is a fixed amount. This is also, if you've ever heard of the spoon theory, it's the same idea. It's basically acknowledging that there's a fixed amount of energy to play with, and we need to be mindful of that battery management. This is true for everybody, but it's especially true when you have a chronic condition because, again, your chronic condition is using up some of that battery. And so you have to be more mindful and thoughtful about how you're going to spend your battery. And so pacing is one of the key skills in that battery management. What often happens for people, and it's a really normal, common response, is people kind of wake up and they, is this going to be a good day or a bad day? And if it's a good day, people sort of feel like, oh, I better get everything done. I better get as much done as possible because who knows when I'm going to have another good day. And so then they kind of overdo it. And then they kind of pay for that because they've overdone it. And then they have a bad day. Right. And then the next good day, it's like, oh, well, I better do everything possible because look how many bad days I just had. And so they overdo it again and then they pay for it. And this is a really normal way of responding, but it ends up reducing how much we can do over time and really feeling at the mercy of your condition because it's deciding what you get to do every day. Pacing is about Pacing is about keeping the same amount of activity regardless of whether it's a good day or a bad day. So you sort of figure out, what can I do even on a bad day? And then the real trick to that is not exceeding that amount, not doing more than that on a good day. If you can keep your activity level the same, regardless of whether it's a good day or a bad day, then your illness or condition is not deciding what you get to do that day. You already know what you're going to do because you know what you can manage even on a bad day. And so it makes us feel more empowered because our condition is not deciding what we can get done. Over time, you also end up being more reliable. You don't have to cancel things as often. You have more stability in terms of how much activity you can do, how much things you can get done, because you're keeping things more stable. And so it makes us more reliable and less likely to have to cancel things or not be able to do things because we're having a bad day. Now, the real trick to pacing is holding back on a good day. When you feel good, you have to stop before you exceed that amount. And you need to remind yourself, you need to keep some of that battery for tomorrow. That's often like the hardest part about it. And so the other part you want to think about is that if that battery or the number of spoons you have is a fixed amount, how are you spending your energy? Are you spending it on the things that matter most? Are you spending it on the things that only you can do? Or are there things that anybody could do that you're spending it on? I totally understand that things like laundry and dishes and all those things have to get done, but it breaks my heart a little bit when people use their precious battery for those things. I truly have never met a family that thought that laundry and dishes was the most important thing that their family member did for them. And so if your battery is limited, you want to spend it on the things only you can do that are the most important. And thinking about that. Again, we act like in our culture, if you just try harder, you can do more, but it's not true. It's a fixed amount. And everyone should be having those questions to themselves, be asking those questions about, how am I spending my battery, and is that the best way to spend it? But you need to be even more thoughtful about it when you have a chronic condition. And so often people will say, I have small children or other demands. I can't pace. I can't control how much activity is. That's absolutely true. And so in this case, you want to build a village. And that means we're basically trying to add extra batteries to the system. We want to add extra batteries so that there is more batteries available to do all the things you need to get done. Sometimes we can't take stuff off the list, so you want to add extra batteries. So when you think about this building a village, lots of us have to do it deliberately. We might not have it built in. You want to think about it as more than just your biological family. People often think of their biological relatives. If those people are helpful for you, that's fantastic. But for lots of us, they're not the best sources of help. It's perfectly okay to invite other people into your village to help out that might have skills or abilities that our family of origin doesn't have. If you think about it, if everyone in your village was your biological relatives, that would technically result in inbreeding, and that's not a good idea. We want to rely on technology, things like virtual connection with people and virtual relationships. Studies show that being in person is better than virtual, but being virtual is definitely better than nothing at all. The world has opened up for people because so many things are online, and so take advantage of those connections. There's going to be lots of different parts of your village. Some parts might never meet each other, and that's okay. You don't have to have the same person doesn't have to be your all for everything, right? The butcher could just give you your meat, right? You can have certain groups that help you with certain tasks. They don't have to be part of every aspect of your life. Healthcare providers or patient groups, for example, can be part of our village. They can be people that are supporting us, adding extra batteries. And then for people who have the means available, sometimes paying people to be part of your village is a great use of your money. Not everyone can do this. I totally get that. But if you do have that ability, sometimes it's a great way of spending your money to give something that you don't need to do to somebody else, and potentially something that's they're going to be able to do faster or more efficiently because they do it all the time. If you think about handymen, I have a babysitter sometimes that she's part of my village. She helps me add extra batteries to the system. Now, it's often really difficult to ask for and accept help. And we know this. People don't want to be a burden on other people. But you want to also remember, there's probably been times when you've helped somebody else out and it actually made you feel better. It didn't actually deplete your battery, it actually improved your battery. And so it's not a zero sum game. Just because somebody's helping you doesn't mean that they have less battery. And in fact, watching somebody who is struggling that you care about who won't accept your help is actually way more of a drain on our battery than if they let us help. And so don't deprive the other people in your life the opportunity to support you, the opportunity to give you help. And this will make things better overall, because you'll be able to spend your battery on the most important things. And so we know that can be a challenge for people, but it's a really necessary skill in order to be able to manage that battery. And it's true for people with chronic disease, but it's true for most of us nowadays. So I just want to offer some additional resources. We know that there are not enough mental health providers. We know that mental health is one of like the key areas that people talk about, that patients want more support with, and that healthcare providers often are ill-equipped to deal with. There will never be enough psychologists. There will never be enough mental health providers to deal with the need. And so one of the things that we work at our company is how to make more scalable options to get science-based information to people more easily and more accessible. And so we've created an app, because everybody creates an app, but it's hard to make a good app, it turns out. The first courses that we teach on this app are about burnout. So basically how to charge your battery. We'll also have special courses for people with chronic disease, as well as special populations like physicians or lawyers, to help them understand how to apply this content. So you won't be able to read the words up top, so sorry about the formatting for this presentation, but basically there's courses that content you can go through. It's 5 minutes or less per day, because we know everybody doesn't have enough battery to be able to do more than that. You can track your progress. So there's a habit builder that we use to support change every single day. And this is helpful even when you see a psychologist, because we want people to have that support each day rather than just once a week or twice a week or once a month. You can track your battery charge, so you can get to know how your battery is and where that's at. And then there's all kinds of skills. So the entire app is based on acceptance and commitment therapy, which is an evidence-based treatment for a number of different health conditions, as well as mental health conditions. And so this is really our effort to try to help people get access to science-based information in a more scalable way. And so, you don't have to do it alone. This is another way to add batteries to your system. You can get science-based support every day. And so that's another resource that we're trying to make available for people. It is a paid feature, but to try and make that more accessible for people so they can get more help. So that's also my website. If you have, you can go look at other resources on there as well, and my contact information.
Thank you. Thank you so very much for all of that insight. I was writing down feverishly all of these points that you were sharing, um, and really exciting to learn about that app. Just before we go into some questions, maybe what we'll do is once that app is available, we'll share it via a newsletter to all of the members so that they can access that. So thank you for very much for that. And it's great to see leveraging technology to help us, right, to meet people where they are. So I do have a couple of questions here, and the first one is, my partner doesn't get home until late, but then my batteries are drained, and she's still active and looking to discuss plans and have in-depth conversations. How do we resolve this dilemma?
Yeah, so this is where we want to think about battery management and kind of think about where your battery is at and how you're spending it. And so, whether your partner gets home late or whether it's like when you get home at the end of the workday, have you spent all your battery already? Do you get home from work and there's no battery left because you spent it on all the other things during your day? And again, ask your partner, is it more important to them that you did the laundry or that they have time to talk to you at the end of the day? And so battery management is about making sure you save some battery for them when you do have time to interact with them. And it means, again, holding back when you could do more so that you have some battery available for the things that, again, are most important in life, like our personal relationships, about the people who matter most to us.
Mm, that's great. Thank you. Thanks. Good insight. And those are difficult conversations to have sometimes, but
Well, and it's a lovely way to have a conversation in your family is about batteries. Do you know what I mean? Like have that conversation with everybody in your family, because often you can support each other to go recharge your batteries, right?
mm,
It's a different thing to say, I'm going to the gym to recharge my batteries. Can you watch the kids? Right? Because when I get back, I'm going to be a better mom. I'm going to be a better partner. I'm going to be in a better mood. I'm going to have more energy to do the things that matter,
mm,
right? That and it's a lot easier to talk about it in terms of batteries. There's also
mhm,
like people are different in what drains their battery and what charges their battery. So sometimes figuring out household chores based on trying to make sure everyone has a good level of battery, but
mhm,
matching that up with the things that take a lot of battery for people and some that take a little. Like in my work team, I have a member who, one of our team members, she loves making spreadsheets. She loves looking at details. She loves looking at all these numbers. I could do that, but it would use a huge amount of battery for me to do. It takes her very little battery because she really
mm,
likes it. And so matching up tasks like that when you can be a really good efficient use of our batteries to pair that up with things that take less battery for us and then take on things that are low battery costs for us to help out.
Great examples right there. I do have another question here. And this is the uncertainty of not knowing when flares will show is exhausting. I feel like I'm always bracing for the worst. How should I manage? How should I manage these emotions?
Yeah, so that's part of pacing, right? If you are pacing more consistently, your flare ups won't be as frequent, as intense, or as long. You will still get flare ups. Again, you can be doing everything right, and your condition will still be up and down, and could still progress. But if you're pacing your activity level, you won't see the extremes in the same way you do if you're not pacing. And it also, again, helps us feel more empowered because we know what kind of activity we can do even on a bad day and we can keep that up. But it, again, means holding back on a good day, and that's like your best strategy to manage flare ups. And then the other thing you want to think about, I get like health symptoms as well when I've overdone it. Right, I'll get like tension in my neck, for example. When it gets really bad, I'll get a headache, and I used to get really mad at my body. I'd be like, "No, I want to keep working. Why are you doing this to me? You're preventing me from working." And now I need to see it as like, okay, thank you. Thanks for letting me know I'm overdoing it. Thanks for letting me know I need to slow down. It's super frustrating when you can't do the things you want to do because your body won't let you, but it's trying to take care of you. It's trying to give you a warning signal before it gets worse, before it gets to be something that it can't reverse. And so you want to look at those flare ups as like with gratitude of thanking your body for giving you messages that you need to slow down and take care of yourself.
Mm,
And that's how I try to approach it, even at the same time of being frustrated that I can't get as much work done as I want to.
yeah, that's really good insight. And then we'll just move into the one final question that I have here. And it's about the resources. So I know that you already shared some amazing resources. It's about work. I don't have benefits and I'm on a fixed income due to my condition. Do you have any suggestions for other resources that are free?
Yeah, so there are some free resources. Wellnesstogether.ca is a government run mental health resource that's free for everybody. So there are some of those resources. We have some research studies you can find through our website that, again, offer free resources if you're willing to be a research participant and share your experiences, which then, again, helps other people. Our app we're trying to make really affordable. It's $10 US per month to try and make it something that people can access even on low income. And we actually hope that, organizations, companies, drug companies will, purchase the app for members so that, again, it's more accessible for people. There are those kind of models as well. And we often target workplaces to try and get them to purchase it so that their employees can have it and don't have to have the additional burden themselves of paying for it. So those are some of the things, that you can access. We know it's a huge problem. Even when you have resources, there's huge wait lists for mental health support. And so it's a big problem. And that's some of the ways that we've been trying to, leverage technology to help people, but we know it's a big problem.
hmm That's great. Thank you for that. And just as we wind down our session here today, I just wanted to extend, our deepest gratitude to you, Dr. Lee Bagley, for all of your knowledge and the insight and your expertise that you bring. It means a great deal to us and to the members of the CSA. And when I was listening to the whole recharge of the batteries, I couldn't help but think about my cell phone. Right, I am adamant about making sure that my cell phone is
Exactly.
charged, and so
Yep.
applying that same mindset to me as an individual, I need
Yep.
to improve on that. So and then I also wanted to just mention, and for those who haven't seen it, there's a previous webinar where we touch on support and the importance of accessing support to help manage and navigate the disease. And so those resources are available on the CSA website, and that's sparthritis.ca. We always say you're not alone. There is a team of SPA warriors ready to support you, whether that's through support groups or resources online. And I just wanted to extend a thanks to everyone for joining us today.